My name is Jacques Larroude. I'm the Rapid Response Team Manager for CARE Canada. I have about 20 years of experience in humanitarian response and recovery. ERT is an organization that was created about 5 years ago by CARE and Rapid Response Team. And it was formed to be able to support the country offices where CARE is having programs. And we have about 92 of these currently. So this team is specialized in responding to humanitarian emergencies, as well as doing some stopgaps for these country offices which request it. We decide to deploy based on the demand and the level of emergency that we face. For example, Idai cyclone was a major emergency in the last 6 months, and we deployed 6 people in this location. Once the decision has been made to deploy, we receive a request from the country office. We see who is available currently in the team, what specialties are needed. We match it, as quickly as we can, and then we deploy the people, usually within 72 hours. Regarding Cyclone Idai, the cyclone made landfall in Beira, Mozambique, on March the 15th. It was the second landfall, actually, because there was a preliminary tropical storm before this, and the destruction on Beira was massive. Beira is a city on the coast with 500,000 people. 90% of the city was destroyed during that storm. About 600 people lost their lives, and thousands more, were missing. And it's possible we'll never know the exact casualty toll. Thousands of people were displaced in with the rising water, and their houses destroyed. We learned of it ahead of time because we could track this a few days before. So we had a team member deployed, a team leader was deployed on the 15th, the day the cyclone made landfall, and were able to respond quickly with the country office, as well as with an initial member of the rapid response team. What was mostly needed originally was, of course, the search and rescue operations, which were handled by a group of international non-government organizations, as well as the authorities in Mozambique. Soon after, the usual people needed, obviously, shelter, food, clean water, because the risk of diseases was quite significant at the time, and there were cases of cholera. Thankfully, there were very few casualties from that, but it's thanks to the work of the organization and the responses. The aid is, the basics. We're talking hygiene kits. So what is an hygiene kit? An hygiene kit is a kit which should supply a family of between 5 and 6 people, 2 adults and 3 or 4 children, with the essentials in terms of soap for personal use, soap for washing their clothes, some sanitary napkins, towels, all the essentials, toothbrush, toothpaste, all these essentials that we often take for granted here, but which are in dire need when people are displaced without any means to maintain, hygiene. The food aid is usually rice or maize coming in bags of 20 or 25 kilos, and then the people are able to survive on this for a period of up to a month. These are emergency rations we're talking about. Many of these people were living in rural areas, and they're very, very hard to reach. In the best of time, Mozambique's infrastructures can be difficult to access. The infrastructures might be not in such a good shape that it's quite difficult to travel. So you can imagine when the flood waters started, the first interventions were via helicopters, which is a very, very costly and a very ineffective way of reaching people, but that was the only way. Then boats were arranged. So in there was a lot of these activities going on. As the water receded, then road access was restored, and more classic way of supply, like trucks and 4x4 vehicles, were available. The supplies, there were sufficient supplies, but the logistics of getting these to the affected communities was really and still is, difficult, very, very difficult, due to what I described earlier as far as poor infrastructure and limited amount of transport. The recovery, our predictions, again, it's very hard to tell, but at least several months and possibly a few years. When we talk recovery, that implies getting the people back up to the level they were at prior to the disaster. But we have to keep in mind that already many of these people were being assisted in long-term development programs by CARE and other agencies. So recovery, we try to, of course, exceed the levels that these people are at to start with, and some of them are already in difficult, precarious situations. So, so we're going to try to join the recovery effort with the development process and give people, you know, even better conditions that they had prior to the cyclone. We do have a country office in Mozambique as well as in Malawi and Zimbabwe, which are also affected to a lesser extent. And in these offices, we have many national staff who indeed have family members and sometimes have themselves affected by, you know, the disaster. In the case of Beira, we did not have an office in that particular city, but we did set one up very, very quickly and hired people from the area. So these people indeed are sometimes the ones suffering also, and their families, you know, from the effect of the disaster, and employing them in being active members of the recovery effort is also a big, you know, helps in the dignity that we try to maintain when these people are faced, so they don't feel hopeless and they're actually part of their, you know, their own recovery. So we do that and take into consideration these challenges. Other organizations that are responding to this emergency have been for the last 40 days. The coordination in the case of Mozambique, there was a consortium of 3 organizations, CARE, Save the Children, and Oxfam, linked forces and resources to be able to respond to this emergency. And I have to say that CARE has been the lead in that consortium, and we have achieved quite significant results of 80,000 people have been directly, you know, assisted, and significantly assisted as well, not just token assistance. We're talking longer term assistance. There was a lot of water and sanitation activities which rehabilitated wells and drinking water supplies, which are extremely important to prevent the spread of diseases, cholera being, you know, one of them, but other waterborne diseases can have dramatic effect on the population. So we have avoided a major cholera outbreak thanks to the work of CARE and the other organizations involved. The help that we need, you know, after this cyclone is to get back to a development kind of focus once the recovery is achieved. In the case of Malawi, Zimbabwe, and Mozambique, this will take, again, this will take a long time. That Cyclone Idai was the 3rd most intense recorded, you know, in that region. So it's a significant disaster, which was, unfortunately, as we learned in a week ago, a second cyclone has hit the northern part of Mozambique. So already thinly stretched resources are being stretched even further. And in the RRT, we had, at the highest peak, we had about 7 members of the rapid response team deployed there, have been doing a great job, 7 days a week, days of 10 to 12 hours. And we have to relieve the people, you know, after a couple of months. So we have new people coming in, and it's been a challenge, but that's what we're here for. So I thank you all, you know, for the support that you have provided or will be providing, and essentially we couldn't do that job, you know, without your support, and we greatly appreciate it. Thank you.